Welcome to Class Matters, the podcast where we ask the question, what would our country look like if it were governed by and for the working class? Class Matters is a project of the Debs Jones Douglas Institute. I'm Katherine Isaac, Executive Director. Today, in episode 13 of Class Matters, we're talking about Medicare Advantage, what it means for union retirees, how it impacts both collective bargaining and the future viability of traditional Medicare. We're joined today by Marianne Pizzitola, Roach, and Mark Dudzic. Welcome all of you to Class Matters. Let's get started with introductions. Marianne Pizzitola is president of the New York City Organization of Public Service Retirees, which is working to empower retirees to defend and protect their hard-earned benefits. She's also the founder and president of the New York Fire Department EMS Retirees Association. Under Marianne's leadership, the New York City Organization of Public Service Retirees has challenged, quite successfully so far, an effort to push retirees onto Medicare Advantage. Roach is the national coordinator for the Labor Campaign for Single Payer and serves as chair of Healthcare for All Minnesota. In her 34 years in the labor movement, Rose served as executive director of the Minnesota Nurses Association and represented public school employees in both Minnesota and California. She's been a passionate advocate for healthcare justice for 2 decades and was recognized by the Minnesota Physicians Magazine as one of the top 100 leaders in healthcare in 2016 and in 2020. Rose has served on task forces led by Minnesota Governor Mark Dudzic and Minnesota Attorney General Keith Ellison. Recently, she received the Women's Trailblazer Award from Congresswoman Ilhan Omar and Minnesota Democratic Farmer Labor Party's Paul Wellstone Lifetime Commitment to Organized Labor Award. And finally, Mark Dudzic served as president of Local 8149 of the Oil, Chemical, and Atomic Workers Union, as well as president of OCAW District 8 Council. Dudzic was a founding member of Labor Party Advocates and succeeded Tony Mazzocchi as the Labor Party's national organizer. In 2009, Dudzic co-founded the Labor Campaign for Single Payer Healthcare and served as its national coordinator until 2022. So let's talk about Medicare Advantage. This year, 2023, marks the first year where more than half of all Medicare recipients are enrolled in Medicare Advantage plans, basically privatized Medicare, than are enrolled in traditional Medicare. This comes at a time when fewer and fewer retirees in this country have an employer-sponsored retiree health benefits to fill the gaps in traditional Medicare coverage. In fact, only 13% of large employers currently offer retiree health benefits, and of those that do, half, 50%, are providing the benefits via Medicare Advantage plans rather than traditional Medicare supplemental plans. Unions that have bargained for retiree health benefits are under increasing pressure at the bargaining table to accept the Advantage plans or to risk losing retiree health benefits altogether. What are unions facing? What are retirees facing? And what should the labor movement be doing about it? Today, we'll take an in-depth look at these questions and get the scoop on the battle that public service retirees in New York City have, for the past 2+ years, been waging against the city and their unions to keep their hard-earned health benefits. So let's go to our first question. We've heard a lot of controversy around the Medicare Advantage program. Rose, can you explain how it differs from traditional Medicare?
Sure. You kind of touched on it when you said it's the privatized portion of Medicare. So Medicare Advantage is really just a misleading name that's given to that privatized portion of Medicare. It's the portion in which tax dollars are funneled through insurance companies. And it's a boatload of taxpayer dollars that we're talking about here that is earmarked for healthcare, but not necessarily all of it is going to healthcare. Medicare Advantage is really not Medicare. A report issued just a few weeks ago that was entitled Our Payment, Their Profits by the National PNHP, Physicians for a National Health Program, found that Medicare Advantage overbills taxpayers by a minimum of $88 billion and up to as much as $140 billion per year. that would be enough to wipe out the need for us to even pay any Medicare Part B premium. And this overbilling or overcharging happens through these Medicare Advantage insurance companies as they market to healthy seniors. They discourage those that are not so healthy by instituting things like prior authorizations before you can get the medication or the treatment or procedure that your direct care provider has determined you need, and sometimes by just outright denying the claims altogether. And also through a scheme that's called upcoding. And this real simplistically is where the insurance company adds diagnostic codes to your record to make you look sicker than you are, which can result in a payment from Medicare to that insurance company that can be as much as 3 times the amount that it actually should be paid. So Medicare Advantage, the bottom line is it's depleting our precious Medicare fund, and time is of the essence to stop it. We're really close to losing our Medicare, and we absolutely have to make sure that we are engaged in protecting it, expanding it, and improving it.
Thanks, Rose. So with narrow networks and upcoding and cherry picking, why are so many retirees choosing to go on Medicare Advantage plans?
Great question. Traditional Medicare doesn't really have what we refer to as a level playing field when it comes to competing with these Medicare Advantage plans. So on the surface for retirees, it appears as though the Medicare Advantage plan is really the better choice. Not necessarily so much once you get trapped inside of it. I'll just highlight a few things that if you take traditional Medicare and you get a supplemental or a Medigap plan versus what it would look like if you chose the Medicare Advantage. And then I'll tell you the bottom line as to why people choose the Medicare Advantage. Things like your out-of-pocket costs. Under a traditional Medicare with a Medigap plan, you're looking at zero out-of-pocket after the Part B deductible, which is only $226 a year. Medicare Advantage can be as high as over $12,000 a year in additional out-of-pocket costs. And it also is that in-network, out-of-network, as you said earlier. Networks, traditional Medicare and the Medigap plans, they're portable. Any place in the country will take them. Not so much when it comes to a Medicare Advantage plan. You also have the downside to traditional Medicare, as I said earlier. There aren't some benefits like hearing and dental and vision that will get sometimes put into some of the Medicare Advantage plans, making them look a little bit better than the traditional Medicare. But this whole issue of utilization, meaning, them getting to do the prior authorization and denying your claims, that is an absolute rarity when you have traditional Medicare. But at the end of the day, Medigap plans can cost anywhere, $150 to $200 a month, in addition to what you're paying for your Medicare Part B premium. Medicare Advantage plans sometimes are zero out of pocket in addition, maybe even as little as $18 a month. Retirees are on fixed incomes, right? So they have to watch their pennies without a doubt. The problem is, as it is for active workers, no different for retirees, it's always about, can we afford to pay a little more on the front end? Because in the back end, we're not going to get that surprise bill for that $12,000 that we don't have saved to be able to pay for it. And they also set lots of secret rules in Medicare Advantage plans. There's no transparency, that we really don't know how they operate. They can change formularies on drugs in a nanosecond in the middle of the year, and there's nothing that you can do about it. And it is important to note that 18% of the claims that are denied by Medicare Advantage plans back in 2019, the latest data we have, would have actually been approved by traditional Medicare. So this is why the labor campaign is working together across the nation with state feds and retiree councils to bring forward a resolution that says we have to level the playing field here. We have to claw back all of that money that they are not using on healthcare, that they are fraudulently taking from our Medicare fund, and instead make traditional Medicare, cut down the out-of-pocket costs, increase the benefit level, and make it actually something that seniors can afford.
Thank you, Rose. I believe it's also true that some retirees don't have a choice. They have to go into the Medicare Advantage plan. And I think that's where Marianne comes in. So Marianne, if you could tell us how being forced into Medicare Advantage is playing out in New York City with its public service retirees, just kind of walk us through the battle that you have waged against both the city of New York and the unions that represent you and your fellow retirees.
So one of the things many retirees learned is that unions do not represent retirees in retirement. Once you become retired, they're no longer your union. And we were always under the understanding that even though they weren't our union, and I'm a labor relations graduate, so I always knew that my relationship ended upon my employment expiring, that they would always protect what you had because they would one day be you. And unfortunately, today's young people in these leadership positions are not recognizing that they will one day be us, and that they should be protecting what we have as a floor for them to be building upon. And then, of course, there were the greedy insurance companies that came by and said, hey, I could give you what you're giving them for free. I'm scratching my head going, we're New Yorkers, man. This is crazy. How could you get something better than what I have for free? And they actually bought it. So they were convinced that the Medicare Advantage plans were better. And the language we kept hearing was, but it's enhanced. It's an enhanced plan. We have different things for you. We have perks that you have we can give you that are not in traditional Medicare. And I'm going, enhanced perks. Oh my God, this sounds like one of those crazy commercials on TV at 3 a.m. And that's exactly what it was. And they, in some cases, like this last union, didn't even use the words Medicare Advantage when they were selling the plans to their retirees and their union workers that ratified their contract, that this would be their future. But in all the language, it was, we have enhanced your plan with benefits not in traditional Medicare. And then I said, could you please just jump down to the bottom and tell me if it says like perks, if it says silver sneakers, if it says rides, if it says packaged meals, because my head's ready to explode. And that's exactly what it was. What was happening was, and we've heard this now from unions around the country, insurance companies are coming to them and saying that they can give them a plan for their retirees to replace their traditional Medicare where there's a cost to their employer. Then they go to the employer and say, hey, listen, we can give you this plan for your retirees where there is no premium to it, $0 premium. It would take off your balance sheet what you're spending on those retirees as an OPEB or a post-employment benefit cost, and you can give that to your active workers. It would save you money, make everybody happy. They then go to the union and they sell it to the active union. And one union called to say to me, listen, I don't know what this is, but my retirees are slamming me with your videos because we have a YouTube channel on this. And they said, we don't know what's going on. Could you please explain it? And we did. And they said, listen, the past union president was sold this deal. And then he was also given a job by the insurance company and retired the same year. So they're going around the country selling this mess to unions, convincing them it's better. And then they do. And then savvy retirees were like, no, this isn't better. This isn't right. Because what we also noticed was that the plans, we looked at the contract and we had to fight to get that. And the EOC, where those terms, as Rose had mentioned, the prior authorizations or the design of the plan could be renegotiated and changed for like prior authorizations renegotiated every 2 years, which means that I'll be in a honeymoon period. And then right afterwards, I get slammed. Whereas in traditional Medicare, it'd take an act of Congress to do something which is almost impossible, and we're protected. And you don't have all of the things as Roach said, but it was sold to the employer and the union as a good thing. And that's why they're buying it. And then they hear from us and they just think we're cranky old retirees and they're not understanding why we're pushing back on it because they were told it was better.
So tell us about your pushback.
I started an organization literally in my living room during COVID, and we sent out 40 emails. 17 people replied. I wanted to start an organization for the sole purpose of suing the city of New York to stop this. Friday, August 13th in 2021, we had chosen a bank, chosen a leadership, chosen the name of our organization. We incorporated by that Monday, started a Facebook page, a website, and a PayPal platform, and we were off. And the lawyer accepted to take our case if we could raise a minimum amount of money, and we did. And we did it quickly, as our organization represents 250,000 people. This affects 250,000 retirees in the city of New York. And we filed an injunction to stop them from auto-enrolling us into our traditional Medicare and trying to force us to pay a premium if we wanted to stay on traditional Medicare, because we were promised a choice of premium-free healthcare benefits in our retirement till our death because of all of the things that we did while we were employed, giving up wages, giving up benefits. And so we sued. The judge granted the injunction. It was a long fight. The original vendor backed out because of the length of time of litigation. And then the second vendor in this negotiated acquisition process now is Aetna, stepped up and said they wanted the deal, which they had sued the first vendor. I mean, this was crazy. And then the judge finally decided for us in that case. The city appealed. We won unanimous decision in the first department. And now I have 2 courts, 6 judges siding for the retirees. And yet the city appealed to the New York State Court of Appeals, the highest court in the state. And they took the case, which now that's where I am with there. We filed a second lawsuit called the copay case because they tried to make it so painful to stay in our traditional Medicare with our supplement by imposing copays on every service that they amounted to a car payment. And that was illegal because it also violated the contract. That case, we won that case, the injunction. It got sent back to the New York State Supreme Court. We are in that court actively. We just had that court 2 weeks ago, certified as a class action. So yay us, that's the second one. The third case, we filed a third lawsuit against the city because when the mayor kept losing, he kept changing the rules of the game. And this is the case we call the nuclear option. We had 14 choices of plans because under statute, the city will pay the full cost of our health coverage for every employee, retiree, and their dependent up to a specific amount of money equally. They eliminated all of our choices of plans and only left Medicare Advantage on the table. Therefore, you had no choice. And that's what they were doing. And we called that the nuclear option. That case, we filed the litigation with the injunction. The injunction was granted. The judge found for the retirees. And now the city appealed that case to the first department. And we're now in that court. I have 3 cases in 3 different courts, and we haven't lost yet.
Well, congratulations on your victories. It's just astounding, though, that this is what it takes to get the benefits that you negotiated when you were working and should be yours as retirees. Thanks for telling us the story. So, Mark, let's turn to you. You work with unions all over the country and talk to them about their health plans and about the possibility of Medicare for all. But can you just kind of tell us what unions are facing at the bargaining table on healthcare? And why is it sometimes that Medicare Advantage is an attractive option? Marianne talked about that a little bit, both in negotiating with employers and in the plans that unions offer in their own health funds.
Yeah, sure. I mean, first of all, I just have to say, I'm just in awe with how the New York City retirees have come together and pushed back on this issue. It's just victory after victory. You know, I've been in the labor movement a long time, and you can count those kind of victories on one hand. So, you know, more power to you. And it's opening up a debate through the entire labor movement about what's happening in New York, you know, what unions ought to be doing or not be doing on these issues and stuff. It's really, you know, it's changing radically the facts on the ground. So, you know, let's keep on fighting in New York. But, you know, this is really an issue where unions are caught between a rock and a hard place. There's all of this like perfect storms that have come together to undermine workers' retirement healthcare benefits. Catherine, you mentioned at the start of the call that only about 13% of workers still have retiree medical benefits, any kind of medical benefits supplement to Medicare benefits. And, you know, that's because they changed a whole bunch of rules that impact, you know, how those benefits apply. They changed accounting rules, first in the private sector and then in the public sector, that said that you have to account for the cost of future retiree benefits on your current accounting sheets, which creates all kinds of issues about deficit spending and everything else. They changed bargaining rules. You know, Marianne mentioned unions can't negotiate for retirees. I mean, I was shocked when I was bargaining contracts in the private sector when, you know, I found out that the labor board and courts had ruled that we no longer could bargain on behalf of retirees. And that was, it's a double-edged sword. I think you've used that issue really, you know, kind of like in a jujitsu way in New York City to, you know, kind of change it. But, you know, it meant that these retirees were often on their own without any kind of organization and no one to fight for them. And then bankruptcy laws, which allowed, particularly in the private sector, courts to just say, hey, you know, you work for Eastern Airlines, they're bankrupt, you no longer have any benefits. That's just the way it is. You're way down on the list of creditors. So all these things kind of came together. On top of that, healthcare is darn expensive. It's, the most expensive thing besides wages that we bargained for. $24,000 a year for employment-based family coverage. The Kaiser Family Fund just put their report out. I would imagine the sort of Cadillac benefits that New York City retirees have, where the city even pays for the Part B premiums, that for a retiree with a spouse, you're looking at $10,000, $12,000 per year for that package. So there's a lot of money there, and it's heavy bargaining. For the last 40 years, medical benefit concessions have been on the table because of that issue. And then, retirees are vulnerable. They're not active members. They're not paying union dues. They're not, in most unions, not all unions, they can't vote for the union officials. And, I think maybe they've changed the equation in New York City, and hopefully other places will learn, but they were considered as, pretty vulnerable and quiet people who are going to not raise a ruckus. And so they're an easy target for these type of things. The most vulnerable people are often hit when you engage in concession bargaining. It's, the same reason that you have two-tier systems that have lower wages for new hires. And in the end, it destroys the solidarity that you need to build power. And that's why the auto workers are attacking all of those kind of systems. So, in the midst of all of this, Medicare Advantage often seems like an easy way out for people at the bargaining table, because the costs are so much lower. The coverage, a lot of the costs are shifted on to the federal government because of subsidies. So the boss don't have to pay it because the feds are going to subsidize the plan. You got the wraparound idea where you can get some version of dental and vision and hearing and other benefits. And, some people, they don't do their homework. And, especially when these plans first came around, they looked like an easy way out, a way to solve a problem and still maintain some level of coverage. And then honestly, in some situations, there were no other alternatives, because there was like a set amount of money available at the bargaining table. And this was the best of the worst alternatives for the most number of workers covered. So there are a lot of trade-offs and stuff that unions have had to make, even when they know that Medicare Advantage is not the best option. And then and I've been talking to unions recently, even unions that still provide an option for people to choose either traditional Medicare with a wraparound plan or a Medicare Advantage plan. They're now under pressure to use the cost of the Medicare Advantage plan as the base cost for all the other plans. So yeah, you can still get the traditional Medicare wrap plan, but now it's going to cost you 3 or 4 times what the Medicare Advantage plan is going to cost you if you're paying a portion of your retiree medical benefits. So they're pushing people out of these plans the same way they pushed workers out of indemnity plans 30 years ago, when you used to have to choose, you could choose between an indemnity and a PPO and a HMO. Only the sickest people chose the indemnity plans, and the cost shot up and they disappeared. And that's how they're going to slowly privatize it, even when unions have the capacity to fight to hold it. So we really got to, address this issue head on. It's just sitting right there, and it's connected to all of these other issues about how employers organize for concessions at the bargaining table and how they keep us divided from each other.
Thanks, Mark. Just to follow up on that, the Medicare Advantage insurers would like us to think that those plans cost less, right? That's supposed to be the big attraction. And you're saying that, unions are seeing that, right? But that's not the whole picture, right? Can one of you talk a little bit about where the money's coming from and where it's going? Rose, you want to try that?
We're paying for it. It's coming out of Medicare. It's coming out of Medicare Part B premiums. I mean, this idea that somehow we literally aren't paying for that is insanity. Of course we're paying for it. And that's the big scam, right? That's the problem with it.
This is part of this whole privatization assault that's happening, throughout the public sector. First of all, there's all these companies that are going to profit by it. So they have this profit incentive to just push. And then there's this weird, almost religious belief that somehow the free market is going to create rational cost savings without hurting anybody, because people will have these choices. And, even when it's shown time and time again that it doesn't work, that the plans cost more ultimately than traditional Medicare plans, and they produce worse outcomes. People are trapped in these plans. People try to escape them as soon as they get sick and realize how lousy the coverage is. It's great when you can get your gym membership when you're nice and healthy, you go to the gym every day, and then God forbid you have a major medical condition, and all of a sudden they're telling you you can't go where your doctor thinks you will get the best treatment. And they're telling you you've got to appeal every time you need a new treatment. And then you try to get out. And if you're in a state that doesn't have what's called guaranteed issue, you can't even buy an affordable Medicare wrap plan to supplement your Medicare plan anymore because you now have a pre-existing condition. Luckily, states like New York, you can still come back into the Medicare wrap plans without that restriction, but there's only a few states, I think it might be 4. So, these are the kind of traps that they set. And, and the companies, that profit from them are the ones who are driving the system. And, in fact, I just read recently that many large insurers are now shifting almost all of their business into these publicly subsidized, privatized plans, Medicare Advantage. They're doing the same type of thing with Medicaid plans, children's health plans, all of these plans. They're actually more profitable for them than selling individual policies to people or selling coverage to employers. So those are some of the dynamics that are driving this.
And it's not just pre-existing conditions. Those 4 states is New York, Maine, Massachusetts, and Connecticut with a guarantee issue right. It's not just pre-existing condition, it's also age. So I have retirees all over the country that are disabled. I have a quadriplegic that lives in Arizona. I have a gentleman who is a kidney patient and he is in Florida. So these retirees who are under 65, some of those states don't have a guarantee issue. You're not guaranteed to be issued a Medigap plan if you're under 65 years old. So if you are in an MA plan, Medicare Advantage plan, to start with, and you're trying to get out, not only will the premium be so cost prohibitive, in some states, you may not even be able to get one until you're 65. And that's what we were running into in the course of our litigation preparation to learn how would people be harmed in other ways? Would they be forced into this plan that the judge recognized that we would be harmed detrimentally? That this could technically kill people or financially harm them, that they would only have their traditional Medicare, but they would not have a supplement access to them that they could afford or that would even be offered to them in the state that they were currently residing.
I wanted to add too that this is, Mark, when he said cost shifting, that's what this is all about. No different. Again, I'm just trying to connect the dots here between the active bargaining table around active employees' health benefits versus retiree welfare benefits, right? It is about cost shifting onto the worker, the retiree, whatever. We've been dealing with it forever at the bargaining table. I mean, when you consider the fact that Humana has now decided to pull out of the commercial market because they are making way more money on it's hard to find a public health program in this country anymore that isn't privatized, whether it's Medicaid or Medicare, they all are. That is a huge part of the problem that we're dealing with here. And there is, as I said earlier, so much secrecy in how that money is spent. As taxpayers, don't we want to at least know that, how that money is being spent on individuals and on their actual health care? And the fact of the matter is it's not, because we see the big profit margins that are coming in from all of these insurance companies and really the medical industrial complex as a whole.
So what's happening in New York can't possibly be an isolated case, right? I'd like to hear from all 3 of you what you're hearing from other retirees and union retirees around the country.
Yeah, here in Minnesota, a good thing under statute in Minnesota for the state employees, it does guarantee that they will have retiree health benefits. Now, that's the good thing. I don't know that it's necessarily a bad thing in respect that the unions don't negotiate it because it's statutory. So therefore, it's really the employer, who in this case is the state, makes the decision about what that benefit looks like. It can't be less than, right, like actuarial values and all that fancy stuff that they do with, insurance pooling and everything, than what the actives have. But there are ways to take a Medicare Advantage plan, of course, and make it seem, basically seem comparable. But again, it's of course cost shifting at the end of the day. And that's exactly what the state of Minnesota did, apparently, put all of those retirees into Medicare Advantage plans. As I'm going around the state of Minnesota and I'm doing Medicare Advantage disadvantage, as I call it, Medicare disadvantage education, I'm getting in front of tons of union retiree groups that are very interested in learning about this issue. And more than a few of them raise their hand and say, yeah, I didn't have a choice. I only got Medicare Advantage as my option as a retiree. So it is definitely not unique to New York or any particular part of the country. That's for sure.
Marianne, what are you hearing?
Basically the same thing. We've been approached because of how public we've been from other unions and retiree organizations fighting back, not just enforcing them into Medicare Advantage plans, the lack of information, the aggressiveness of the insurance company in auto-enrolling them into these plans, not giving them access to the list of prior authorizations, or how do they fight the approval of the denials for prior authorization as well, or the network issue, where now that they're finding that their hospitals and doctors are not in the plan. We've been helping Cortland County, New York, fight United Healthcare. I made several phone calls to their plan yesterday, and the lady kept telling me that they couldn't even talk to me about the plan because it was now being controlled by the personnel office. We called the Aetna plan, which is also several unions within New York City, as well as Stamford, Connecticut, Delaware retirees. These were all retirees that reached out to us. And the active union in Stamford said to us, what's going on with this Aetna thing? That was one of the unions that was very concerned about it, and their retirees were very concerned. We got called by both. How do we fight this? How do we stop it? And what we did was, because we still identify as union, we are retired labor. I said, I need your contract. Show me what your contract is, because we know we retire under what our contracts the last contract that we had. So I was able to save one of those unions from being forced into this plan, because his contract from the 90s still read that Medicare choice risk choice plans would be an option, and that it couldn't be something that they were forced into. He goes, what is a Medicare risk or Medicare choice plan? I said, that's old language for Medicare Advantage. And he says, really? So he brought it back to the bargaining table, and there were 2 unions out of the entire county that didn't get forced into those plans. But this is empowering unions to know, don't fall for this. I think when we spoke, we first joked about a movie that I love movies. So I said the movie from Back to the Future, like where, the character said, it's sometime in the future, someone's going to come up to you and tell you, they're going to try to take away that sports almanac, or they're going to tell you, so I said, don't go to that crazy guy with the book. I said, we need to tell our union leaders that sometime in the future, some greedy insurance company is going to go, I got this plan for you and it's free. Just say no. And that's what we have to teach them, is that they can do this by fighting for their retirees, because this is their future. That one union in Connecticut, they were fearful because the union's attorney said, no, don't worry about those retirees. You don't represent them. Let them fight their own thing. And I said, yes and no. Because if you let them on their own, they're going to get screwed. You must identify that that is your future. And if you recognize that what's happening to them and you don't help them, then you are paving the way for you to be screwed in your future. Stop this here. And he did. He's the first union that I ever helped that he actually stopped that from happening. And I think that's what we have to do, is empower the unions to understand the difference and how to give them that control back.
Absolutely. And I love the way you put it, that is your future. The last thing we should be doing is pitting retirees against active members. That's the boss's dream, right? So, Mark, did you have anything else on that?
I think the thing that I'm seeing right now is that unions, I know the New York situation, is really difficult, and, the unions have not stood up in this issue, and, I'm not here to speak for or against that situation, but I will tell you that in Washington State, for example, they tried to force 53,000 state retirees into a Medicare Advantage last year, and the retirees worked jointly with AFSCME and the Washington Education Association to stop that. They postponed that change last summer. It could come back again, and they're certainly being vigilant there. But that was a positive story where, labor came together with their retirees to really push back. Likewise in Vermont, Last year, they tried to push about 6,000 retirees into a Medicare Advantage plan, and the Vermont State Employees Association, which is the primary union for state workers, worked with the retirees there to turn that back. And they had a big fight. They finally defeated it this past May in Vermont. So those are kind of models, where, victory is possible, especially when retirees and unions work collectively together on these issues. Other places you might not even have that option because the law already says that it's not even a bargainable issue anymore. And those are the kind of places we need to regain the right to bargain over these issues and think about how to build those kind of coalitions.
Thanks, Mark. It's encouraging to hear that there is some pushback outside of the great work that's going on in New York. So I'd like to ask a final question. On each episode of Class Matters, we ask some version of the big question, what would our country look like if it were governed by and for the working class? So today, let's focus on what now appears to be the rapid privatization of traditional Medicare. What do each of you think needs to happen to protect current and future retirees? And what is the role of the labor movement in that vision for each of you? Marianne, would you like to start?
That becomes a struggle for me because it was the labor movement that helped pass Medicare, and it's the labor movement right now that's contributing towards its demise. And I don't think it's intentional. I just think it's misinformation. I believe that there has to be an education on both sides in order to protect that. And I would like to see that labor comes together to support this protecting of traditional Medicare. There's a lot of different talking points about healthcare in America and what would be the solution. I do believe in, like, for example, in New York State, we have a state constitutional provision that prevents diminishment of pension. There should be a state constitutional provision or a state law that does prevent diminishment of healthcare benefits or vested benefits for retirees. Right now, the city of New York is trying to force me to agree to changing vesting dates. We vested for healthcare under 5 or 10 years, depending upon when we retired. The city is trying to force our organization or retired persons to agree to 20-year vesting for healthcare after retirement. So this again still is pitting actives against retirees and then trying to pass cost, do a full cost transfer to retirees. That's how they want to try to settle my case. That's not a settlement to me, that's suicide. And so if I'm going to be a strong labor leader in retirement, because that's what I'm kind of acting like, the grown-up at the table at this point, I am going to say I am not changing what a retiree was promised in retirement when they were retired. I'm not changing their vesting rights. I'm not changing what they're going to be paying, because basically I know what that's going to do. They're going to then be forced to make a decision. Are they going to eat people food or are they going to eat cat food? And I'm not going to do that to people. Are they going to take pills, split their pills, not take their pills, because they have to pay their bills and pay their doctor? We should be protecting each other. And I'm going to do that with every last breath that I have. I don't have the AFL-CIO helping me. I don't have AFSCME. AFL-CIO sells 3 of its own Medicare Advantage plans. I am in an alternate universe. Someone wake me up, because this isn't real. But yes, it is. I think this needs to be a strong educational campaign. Like, we need to get everyone into a labor conference, retirees in the room with labor leaders, CLCs, AFL, AFSCME, and say, dude, we need to talk about this. This is not the way. Let us help you get back on track to protect federal traditional Medicare and the rights of our retirees in retirement. Otherwise, we're going to destroy the labor movement.
Thank you, Marianne. Appreciate your comments. Rose, you want to go next?
Sure. I would just build on what Marianne said, really. I think that, the education piece is so huge, and that is a part of what the Labor Campaign for Single Payer is really taking up right now as a focal point for the organization in designing rank and file member as well as retiree and leader education. We're starting with those resolutions because it opens the discussion, right? It opens the door. And if we can get enough state feds to pass that resolution that says this stuff has to stop, we don't support privatization, and the way we're going to do that is to claw that money back, right? Improve traditional Medicare and make that the gold standard, right, for everybody, that we can maybe then open that space up inside of the national AFL-CIO to have that conversation there and point out exactly what Marianne said. Labor just should not be promoting the privatization of our Medicare fund. We just should not be doing that. So I think education is key. I want to just, remind everybody, insurance companies in 1965, when Medicare passed, the reason it was 65 and older and those who are disabled is because insurance companies didn't want to cover the sick and the old, right? And they've had a real significant change of heart on that. A physician from PNHP once said Willie Sutton, a bank robber from the early 1900s, was asked, why do you rob banks? And he said, because that's where the money is. And clearly, that's what's going on inside of our healthcare system. And remember, with the flaws of traditional Medicare, Medicare desegregated our hospitals. They have fewer barriers to care. They operate more efficiently, and they operate also much more cost effectively than these privatized plans do. So stop letting our employers control our access to healthcare. They use it to divide and conquer us. They bludgeon us when we go on strike and exercise our right to withhold our labor, because then we lose our access to healthcare because you're not on the payroll anymore. That kind of thing is crazy. This has been a massive transfer of our wealth as workers to these corporate bosses in healthcare, because we've seen wage stagnation as we've been trying to fight to keep the premiums at some sort of sensible cost. Active workers, retirees, doesn't matter. We have to get this thing off the bargaining table, come together, take this up as an existential fight inside of labor, and move from resolutionary politics to revolutionary politics. Because once we do that, we can stop this privatization and we can win true healthcare justice for all.
Thank you, Rose. Mark?
Yeah, hard to follow those two, but just maybe to reinforce, first, as Marianne is doing, we as trade unionists and retiree activists have to fight like hell to do everything we can to protect access to health care for the most vulnerable part of the working class, the retired people who work their whole lives and, are struggling under retirement. We got to do whatever we can. That's just, it's what trade unionists do, right? Whatever, we live under a system dictated to us by employers, and we do whatever we can under that system. But then we also have to think about sort of the longer term issues. Rose has really targeted that really sharply. The first step is that we need to stabilize the system, even playing field between Medicare Advantage and Medicare. Stop the egregious tactics of the for-profit, the way they use upcoding, the way all of these fraudulent activities, they need to be stopped so that they can't steal the money and the health care from people. And then we need to upgrade Medicare, which has not really been substantially upgraded. And we need to expand it to include dental, hearing, and vision, and eliminate a lot of those copays, maybe eliminate the need for Medigap coverage altogether so that it's a comprehensive upgraded system. There was an attempt to begin to do that under the Build Back Better Act that Biden proposed in the early days of his administration. And we weren't able to get that through the Senate, thanks to 48 Republicans and Joe Manchin and Kristen Sinema. We got to think about that as we move into this election cycle. And then, I just want to, I think when you even take a little step further back from this, we really got to look at, how are we going to maintain this benefit that only 13% of Americans currently even enjoy? This is how our opponents utilize the politics of resentment to undermine things that workers have achieved. Right across the river from Marianne in New Jersey, when Chris Christie was running for governor back in the day, he was attacking public employees' benefits. And he would go, he'd make these speeches, these teachers here, they got these great pensions and medical benefits when they retire, and you have nothing. Why should you be paying your taxes for them when you don't even have a pension yourself? And those are the kind of politics that really undermine, our ability to even represent the people who protect the people who currently have. So we've got to really think big. We, as Rose said, we got to take this off the bargaining table by making it a right to everyone in America. We've got to expand healthcare, not linked to employment, and, build the politics of solidarity that will protect this as a public good rather than a privatized market commodity. That's the only way we will win in the long term.
Thank you, Mark. Well, this has been a fantastic discussion. I want to thank all three of our guests. Marianne Pizzitola, Roach, and Mark Dudzic. You've been listening to episode 13 of Class Matters podcast. Our podcast engineer is Jimmy Wirt. Subscribe to Class Matters wherever you listen to podcasts, and if you can, support us on Patreon. Head over to our website's resource page for more information about Marianne's campaign, as well as the labor campaign for single payer. And give us your thoughts about this episode. Thank you for listening to Class Matters.